Okay, the book is The Cancer Biopathy, written by the author, German psychiatrist, Wilhelm Reich. Um, Very interesting and important book because it approaches the theme, the disease, from other perspective, considering the unconsciousness, which is the basis, the foundation of psychoanalysis. And it is also not considered, by the physicians as a factor, which determines the disease. Maybe it is the genetic, but no genes, not one, is the cause of the cancer. Anyway, before moving ahead further, we have to remember that the unconsciousness is present, acting in silence all the time, even when we are sleeping, especially when we are sleeping. And this giant, this monster, painted by Goya, the Spanish painter, lifting his fist, ready to go, and threatening people around. Um, and it's funny because if we want to find a solution, we have to focus beyond the problem, the disease, the symptom, because cancer is a symptom. And if you want to understand the cause and remove the cause of the problem, we have to see beyond the symptom. And removing the tumor is not going to solve the problem. But anyway, very important, the most important point, the heuristic point, the foundation, which will lead us, guide us to the end. But anyway, in the book, now we have some parts. Okay, let's now skim through some parts, flip over some pages. Okay, from the case history of the cancer patient and experiment, organ therapy. Remember your soul. Okay, your soul is your body, and your body is your soul. Don't be reckless, and do not neglect, this very important point. But anyway, I would now like to submit the case history of the cancer patient for a particularly revealing of the nature of the shrinking biopathy. So the patient's brother stated that the illness had set in 3 years before in the form of excruciating pain in the right hip bone. The pain was incessant and pulling. At this time, the patient she gained weight. Okay, she couldn't raise herself from a supine position. She had to stay in bed most of the time. She had to take morphine, atropine, but without success, and relieve the pain, ease the pain. The pain remained acute, maybe unbearable, and the patient could not leave her bed. Okay, according to reports from her relatives, she lay flat on her back, immobile. 3 months later, the patient began to have episodes of vomiting. Okay, the pain spread. Um, X-rays showed collapsed vertebra. The patient placed it in a plaster. She was okay. Placed it in a plaster cast. This physician was the first to discover an atrophy of the 10th dorsal vertebra, traceable to a cancerous tumor in the left breast. Okay. The diagnosis of cancer was then confirmed by biopsy. Okay, and the patient underwent X-ray treatment of the pelvis and spine. She remained bedridden in the bed. Another physician then made her sterile using X-ray. Oh my God! When she left the clinic, her weight was down. Okay, she lost some weight. Okay, next part. The patient hospital file provided the following information. 4 months prior to her admission, she had begun to feel pain, her right hip, especially when she walked. It was also difficult for her to sit down, and we were struck by the fact that the pains which kept the patient bedridden for more than 2 years were not originally felt in the area of the cancer tumor. Very important point to be considered. Okay, the pains were in the right hip, whereas the primary tumor was located in the left breast with metastasis and in the spine. The patient also suffered from vomiting. The hospital, okay, flat, in the bed. She had to lay flat in the bed. Could move only with great pain. Lymph glands were not enlarged. The breast tumor measured roughly, enlarged even. At this time, her leg movement were restricted. Okay, the hospital diagnosis was carcinoma of the left breast with bone metastasis. And her physician at the hospital concluded that the case was hopeless. Okay, after the examination of entire spine, the physicians to whom I sent the patient for general examination declared the case hopeless on the basis of the X-rays. However, it was the biological weakness of the blood and not the X-ray photographs that made the greatest impact on me, impression on me. Okay, so 2 physicians who were friends of the patient's family declared that she would not survive more than 2 weeks. Okay, now the most important point, the musculature, armor, the mechanism of defense against the giant, the monster. Okay, the biophysical, we have here the patient saw her jaw was clamped tight, spoke through her teeth as if hissing. She had strong spasms, attempt to pull down the jaw, superficial, deep musculature of the neck, especially of the extraordinary rigid. The patient held her head somewhat pulled in and tilted forward as if she were that is a point, as if she were afraid something terrible would happen to her neck if she moved her head. Remember the giant. At first, no, the manner of holding the head and the neck now seemed to be attributable to the fact that her fifth, okay, cervical vertebra was collapsed. Anyway, the patient had been wearing a collar brace for some time, fracture, cervical spine, consequence, too rapid extreme movement was a possibility. As later now became clear, the patient made a good use of this fact as a neurotic defense. That's the key to understand the cause of the cancer. Her fear of moving her neck now excited long before the collapse of the vertebra. Indeed, her manner of holding her head and neck was only part of a general biophysical attitude which we had to understand not as the result, but as the biopathic cause of the cancer. That's the explanation. So we have to change the focus and see beyond. And remember, the unconsciousness is always there, trying to impose itself. I don't know. Anyway, the unconsciousness, the disease now speaks. That's what matters.